Hi, today we'd like to come back on the topic of Hyperemesis Gravidarum treatment. We're trying to raise awareness that Hyperemesis Gravidarum in fact can be treated here at Antai Hospital, and it comes with a full refund guarantee because of how effective the HCG desensitizer treatment is. Not only is it effective in treatment, within a few days you'll already see symptoms subside. You're able to physically leave the hospital feeling much better, and also the remainder of your pregnancy will be very smooth with no complications. It's also easily administered. There's no surgery required. You won't need to be under IV for long periods of time. You don't need to down medication that you are uncomfortable with that will cause discomfort. It's all administered via injections because this is the highest this is how we can ensure highest absorbance of the medication, and within a few hours you already see that your appetite is restored, insomnia is subsiding, you are able to sleep, all that fatigue and mental stress will slowly begin to alleviate. So here at Antai Hospital, we cannot say that every patient, hyperemesis patient, will receive the same treatment for their hyperemesis because hyperemesis varies from patient to patient. Many patients come with varying degrees of severity, varying types of complications, even different symptoms. Some have predominant symptoms such as excessive salivation. Some have a predominant symptom of unable to sleep. Some have a predominant symptom of excessive salivation. So according to what your individual condition is, we need to individualize the treatment as well. Furthermore, the treatment is also different for each patient to each patient because each patient has different pre-existing disorders. For example, you may have high blood pressure, you may have a heart condition, you may have some depression that is mild, and other disorders that are not really causing any havoc. However, coupled with hyperemesis, it's much more intense now because of hyperemesis. So not only do we need to treat the hyperemesis, we need to treat your individual disorders, and this one, it can be quite tricky if you're unclear of your medical history. We need to be very clear about your medical history and what are your current existing disorders. However, we can diagnose this doing some examinations and blood tests. We can quickly figure out what is going on. So we cannot say each patient is receiving the same treatment and the same outcome. Some patients require 2 to 3 weeks of hospitalization because not only is it very severe, they have severe pre-existing disorders as well. So some patients will recover very quickly because it's their first hyperemesis. They come before pregnancy and they have no pre-existing disorders. This can be a possibility as well. So it really depends from patient to patient. So here at Antai Hospital, we not only are we offering you treatment for hyperemesis, which is something that is dearly needed for many women out there because conventional treatment only deals with symptoms. And not only do these symptoms do not subside, you need to be dependent on this medication for the entire pregnancy. Sometimes they are ineffective as well. So leading to your pregnancy miscarrying, or you need to go for an abortion because you couldn't withstand the terrible symptoms. But here at Antai Hospital, we can preserve your pregnancy with our HCG desensitizer, and we are very systemic about how we want to help you. We need to identify what are your pre-existing conditions, disorders, treat them as well. This way you have a very high success rate, up to 95%. And that's why we are willing to offer you a full refund guarantee, because we are been doing this for over 2 decades now, and we have only seen success. So get in touch with us via the website if you are experiencing hyperemesis. We know it's very difficult, but not to worry, there is treatment now, and very comprehensive as well. And you will receive an individualized treatment for your particular case. Visit our website and also leave me a comment down below.